Sure, thanks, Savannah, and good morning, everyone, and welcome to today's joint news conference with the Alabama Department of Public Health, the University of Alabama System, and the University of Alabama at Birmingham. We have several important announcements this morning on GuideSafe, which is a multi-tool platform encompassing the formerly announced Stay Safe Together and Testing for Alabama initiatives. GuideSafe is comprised of three key components, which are GuideSafe Health Check, GuideSafe Exposure Notification Application, and GuideSafe Event Passport. Also included under the GuideSafe platform are key spread mitigation behaviors for ongoing mass adoption. We will have opening statements this morning from University of Alabama System Chancellor Finis St. John, Alabama State Health Officer Dr. Scott Harris, UAB President Dr. Ray Watts, UAB Professor Sue Feldman, and UAB School of Medicine Dean Dr. Selwyn Vickers. We will also have time for a media Q&A session immediately following the opening statements. Please raise your hand in the Zoom application and we will call on you for your question. So with that, we will begin with opening remarks from Chancellor St. John. Chancellor.
Good morning and thank you very much. I'll be brief. I'm very proud, and all of us here at the system are very proud that the University of Alabama System and the state of Alabama have come together to provide COVID testing to every student at public universities in the state of Alabama at no cost to that student, as well as a comprehensive plan to safely reopen our colleges and universities for the fall semester. This could not have happened without our task force leaders, Selwyn Vickers and Katie Osborne, and the doctors, scientists, and researchers at UAB, as well as administrators across all three of our campuses. It also could not have happened without Governor Ivey and her decisive action to provide funding for this important endeavor and the work of her administration, as well as Dr. Harris and the administrators at the ADPH. It is an honor to work with these dedicated public servants, and we will do our best to provide our students the essential service of higher education safely. Thank you.
Thank you very much. We'll now move on to Scott Harris. Dr. Harris.
Hey, good morning, everyone. Thank you very much for being here today. It's a great day, and I appreciate the opportunity to be included today with these many different important announcements. I serve as State Health Officer with ADPH, and I'm very proud that, that UAB and that our state is able to implement this program, which is really one of the most comprehensive reentry programs in the state, or in the country. There's been a tremendous amount of work done by many different people, many that you see on your screen here today. We certainly could not have done it without the work of all these very many people. I also want to echo Chancellor St. John and say thank you very much to Governor Kay Ivey. We really appreciate her support and her leadership in this. We appreciate her willingness to use Federal CARES Act money to support this program, which is a tremendous program for our state. We're very proud again to be associated with this. I want to commend everyone who's been a part of this program and just congratulate you on the great job that you've all done so far. And again, thanks for having me. I'll turn it over at this time to Dr. Ray Watts.
Thank you, Dr. Harris, and thank you all for joining us this afternoon. I would like to thank Governor Ivey and Dr. Harris and the state of Alabama for placing their trust in the people of UAB and the University of Alabama System during this unprecedented time. As Dr. Harris mentioned, Governor Ivey elected to use more than $30 million of CARES Act funding to provide robust COVID-19 testing, symptom monitoring, and notification of exposure to COVID-19 for all public and private colleges and universities in the state of Alabama. And as Dr. Harris mentioned, making this the most comprehensive higher education reentry plan in the country. Governor Ivey tasked UAB and UA System to use our people's expertise and our resources to help make this plan a reality. I'm excited to say that we have answered that call. Today, in partnership with the Alabama Department of Public Health, Apple, Google, and other key partners, we announced the official launch of GuideSafe. GuideSafe is a multi-tool platform comprised of, among others, 3 key components: the GuideSafe Health Check app, GuideSafe Exposure Notification app, and the GuideSafe Event Passport app. As part of today's announcement, we are also recognizing some key milestones. First is the official pilot launch of the platform's anonymous exposure notification system app. In addition to 20,000 college students who've been invited to participate starting today, the general public can also download the GuideSafe app during the initial phase. At UAB, we have worked extremely hard to leverage research and innovation, community service, patient care, and education to make a positive difference in this pandemic. This new app, using Google and Apple-led technology and created by UAB faculty and staff, along with Birmingham-based Motion Mobs, is a necessary tool in our effort to return to college campuses safely this fall. The GuideSafe Health Check is a COVID-19 assessment tool that allows users to easily report COVID-related symptoms. GuideSafe Event Passport facilitates opt-in access to facilities, meetings, or events with 10 or more participants. The combination of these tools enables every participating college and university to engage faculty, students, and staff regarding the ongoing monitoring of symptoms, exposure, and risk of acquiring COVID-19. Also today, we announced the GuideSafe entry testing that will begin at 11 additional locations across Alabama tomorrow, August 4th. Pilot testing has been conducted in Birmingham and Tuscaloosa since July 26th. GuideSafe entry testing is a free, rapid, non-invasive, nasal-based swab procedure, and it is the largest scale higher education testing initiative in the nation. We will test upward of 200,000 college students over the next 4 weeks as we return to our campuses. I'd like to recognize Dean Selwyn Vickers and Dr. Harris and Dr. Michael Sagg for their leadership of this important testing initiative. We have believed all along that the ability to test every student returning to campus is essential in helping us maintain a safe environment. And throughout this partnership, we have the ability to make testing available to all students in Alabama. UAB's Department of Pathology will process the tests performed on Alabama college students prior to their entry to their respective campuses. They have developed a very sensitive test with high accuracy. Their testing strategy, which is a pooling test approach, allows for the ramping of testing capacity by 10-fold or more. So that we'll be able to test 10 to 12,000 students per day, which is a remarkable achievement. In addition to the work and dedication of the ADPH, Apple, Google, and other partners, I want to thank the University of Alabama system under the leadership of Chancellor Finis St. John and our Board of Trustees for their unwavering support throughout this initiative. And of course, I want to recognize our outstanding faculty and staff at UAB. Too numerous to be identified individually, but collectively, this has been a wonderful team effort. I do want to recognize a few leaders. Dr. Vickers, Drs. Kurt Carver, Sue Feldman, George Netto, Paul Irwin, and their respective schools of medicine, health professions, public health, and information technology, along with the Department of Pathology and the School of Medicine, with many others across campus who have worked tirelessly to execute this mission. With the development of GuideSafe, they have helped build the future through new ideas with an eye to serve students, patients, the community, our state, and the global need for discovery. Thank you, and I'd now like to call on Professor Sue Feldman.
Thank you. UAB is excited to be leaders in the US in developing a platform of tools called GuideSafe, which you've heard about, to monitor and mitigate the spread of COVID-19 for schools, businesses, and communities. The GuideSafe platform would not be what it is today without the support of Governor Ivey, Dr. Harris, Dr. Watts, and Dr. Vickers as champions of the platform for use beyond UAB. The tools in GuideSafe include Health Check, a web-based COVID-19 symptom and exposure monitoring application, and an event passport for healthy entrance into events with greater than 10 people. Health Check and the event passport are available for all schools, businesses, and communities, regardless of location. To date, we have implemented or are in the process of implementing Health Check and/or the event passport in over 33 schools and colleges in the United States, with interest from many other businesses. Additionally, in collaboration with the Alabama Department of Public Health, UAB is also very excited to be leaders in the US in announcing a closed pilot of the GuideSafe exposure notification app. Today, we invite anyone in the state of Alabama with a .edu email address, students, faculty, staff, and alums, to participate in a closed pilot of the GuideSafe exposure notification app, one of our tools in the GuideSafe platform. The pilot will be limited to 10,000 users per platform for each Apple and Android, so 20,000 people total. So if you want to participate, go to guidesafe.org/pilot and register. Your email address is only used for the pilot. Your identity in the app remains private. Then in your email, you'll receive information on how to proceed to be a pilot tester for GuideSafe's exposure notification app. As part of the pilot, we will ask for your feedback through a survey to be completed by August 10th. Regardless of whether you are at school, at work, or in the community, the GuideSafe exposure notification app can anonymously alert you when you have previously come in contact with someone who, within 14 days, tests positive for COVID-19. I want to take a moment and provide details about the GuideSafe exposure notification app. In terms of security, UAB experts, including the app development and security experts at UAB IT, selected the Google Apple platform because of their stringent privacy requirements. There's a lot of inaccurate information out there about what the app does and does not collect. The important details are that while your phone might already be collecting location information, the app itself does not collect or share any of that. No location, no name, it does not access your contact list. All the app knows is the date of exposure, how long the exposure lasted, and the Bluetooth signal strength between the phones. No other personal information. There is a validation system built in for positive test reporting. That validation system that was developed right here at UAB asks for your phone number so the system can text you back the validation code, but your phone number is not stored anywhere. In the notification that I mentioned earlier, all identities are anonymous to both the sender and the receiver. Apple and Google do not receive any identifying information about the users, location data, or any other devices the user has been in proximity of. Some people have asked about casual contact. The GuideSafe notification app calculates close contact, which is defined as within 6 feet or fewer for at least 15 minutes or longer. The GuideSafe notification app is one of the tools that we Alabamians have in our toolbox to fight against COVID-19 and keep our schools and business communities thriving. When we all use it, we all benefit. Our businesses benefit and our state benefits. So remember, go to guidesafe.org/pilot and register with your EDU email address. And with that, I will turn it to Dr. Selwyn Vickers.
Thank you, Sue, and I appreciate the presentation and explanation of this new opportunity. I wanted to, like others have said, really thank the culture and the commitment of service to our state and our system demonstrated by our Chancellor and our President Ray Watts. I think without that outward view for us to serve the bigger enterprise of our community, this wouldn't have launched or taken off. Also, without the governor's willingness, particularly her staff, the Chief of Staff Bonner and Finance Director Butler and Assistant Finance Deputy Director Glenda Allred, they were so critical for us getting this launch, along with Director of the Alabama Department of Public Health, Scott Harris. So we're appreciative of the support to make this happen. I would continually reemphasize this is a comprehensive plan that revolves around not only educating our students, but our state and broad-wide community, making sure we emphasize the issues related to PPE, social distancing, and wearing masks. You've heard great, I think, presentations under the tools of GuideSafe, which are some of the most advanced in the country. So the talent with Dr. Feldman and Dr. Mohan Thuramulai have been huge in pulling this COVID screening tool, which is the baseline effort that every citizen, not only students, but citizens should engage in to know about their symptoms on a regular basis. And then using the ability of technology through the exposure notification app is really powerful. And in many ways, we have led the country in developing this that we want to make available for our students and all the citizens of our state. You heard President Watts mention reentry testing, or entry testing for our college students. We have built an infrastructure and platform with the work of Dr. Netto, Dr. Sag, Bob Phillips, Dr. Agarwal, and Tony Leith, and Rosie O'Byrne to really provide a platform for our students returning. You heard Dr. Watts and Dr. Chancellor St. John mention the number, over 200,000. This is an ongoing effort to execute to make sure we give our colleges the best chance to return their students safely, understanding their testing status and their COVID status. But we also want to see this platform quickly used for testing for our state citizens, not just our college students. We realize that there are efforts and needs across the entire state, and that's part of our vision as well. But as President Watts mentioned, starting tomorrow, we'll have a total of 13 sites available for all of our college students to begin to come and get their testing done, have the results delivered through our UAB pathology lab, which is geared up in an amazing way with Dr. O'Leal and Dr. Netto to provide this testing for our citizens in the state. We believe in many ways this is a model for our country, but in most of all, we want to provide the best service possible for our citizens, including our students who are returning to college. Dr. Michael Sag has led this with Dr. Harris, and the logistics and the infrastructure work has been immense, and it's ongoing to make sure we can get everybody returned safely and allow them to stay safely. The final component of it is that we will do ongoing Sentinel testing to monitor both the ability to look at hot spots in our state where cases are increasing, and we can add the value of increased testing in those areas with short turnaround time, which I know we're suffering from. But then also to have ongoing Sentinel testing across our campuses to really give us an understanding of the prevalence of the virus in our student populations who will be participating in the GuideSafe Health Check and who hopefully will all download the GuideSafe tracing app. So we're appreciative. The work is still ongoing. It's been hard, but we're thankful for the opportunity.
Thank you very much, Dr. Vickers. Appreciate those comments. All right, so with that, we will go ahead and move to the question and answer session. As soon as, or if you do have a question, excuse me, please raise your hand in the Zoom application and Savannah Copeland will call on you and enable your microphone.
Yes, and just as a reminder, please state your name and the outlet that you are with. And if there's a specific person that you would like to hear from, please indicate that as well. And I'll just go through who's raised their hand first. So Michael Casagrande, you can ask your question.
Yeah, this is Michael CasagrandeAL.com. I was just wondering about the 13 locations in the state. Where are they located? How are those locations determined?
Thank you, Michael. Dr. Sag, do you want to take that one to start with?
Sure. The sites were determined really strategically by looking at where the students live, not so much what school they went to, but where they reside, so that they could get to a testing location without having to drive any more than 60 miles. And so these 13 sites are scattered throughout the state, strategically placed on the GuideSafe.org website. You can find the actual listing of locations as opposed to me just reiterating them here, but that's how the sites were determined. And as we said, they're going to be opening up tomorrow.
You know, I'll add to that I didn't mention that the two critical partners in this are the Bruno's events and logistics team. They are a big part of this, as well as Verily, which is a part of Google. They're the other partner in making this happen, as well as Everlywell and PWN, but particularly Bruno's and Verily are big critical partners of making this pull off. And Bruno's is helping is doing the standing up of the sites, and Verily providing the infrastructure for informatics.
Thanks, Dr. Vickers. Mary Scott Hodgen, I will lower your hand and you may ask your question.
Thanks. This is Mary Scott Hodgen with WBHM Public Radio. Could you expand on how the pool testing will work and what is the turnaround time for test results?
Thank you, Mary Scott. Would you like to take that, Dr. Neto?
Yes, I'll be happy to. Thank you for the question. So the pooling strategy depends on when we get the nasal swab, let's assume up to 10 nasal swab, we can gather all the, if there is a virus in any of this, we can batch all of this in one sample and do the test that batch and see if it's positive or negative. The advantage of this, with the anticipated rate of positivity being 1% or low among asymptomatic students, if we do this, a lot of batches are going to be negative and we can report them right away. And hopefully only one out of few batches will be positive. And then we can go back and assign the positivity to exactly the student who was involved, because we keep track all of this. And that's where the IT piece is extremely important in terms of keeping track of all these thousands of specimens we get a day. Turnaround time is within 24 hours. And that's why we had to ramp up capacity in an extraordinary way, something we couldn't do without the support of the state. And this way we increase our capacity beyond the clinical capacity that we have, multifold, that we can use later on for Sentinel testing.
All right, Alan Collins, you may ask your question. You may need to unmute yourself, Alan.
Sorry, Savannah. Thank you. This is for Dr. Harris. Doctor, as we're getting ready to test 200,000 plus students, colleges open, schools opening, where do we stand in Alabama as of today, given the fact hospitalizations are concerned, but yet the county's map of the entire state, we're seeing more yellow, like Jefferson County and Tuscaloosa, former hotspots were red. We're yellow, a moderate risk. Give me an assessment where we are right now with the numbers.
I think we continue to be concerned about the numbers overall. We have had an increase in numbers of cases in many counties as reflected on the risk map that you referred to. We have actually seen a slight decline in our percent positives over the past week. It's fallen by about a percentage point. And so I guess if we have to look, we have to look hard sometimes for good news, but I do feel somewhat encouraged by that. Obviously, as more people get out doing more things, there's going to be increased opportunities for disease transmission. And so I think that's what makes this particular program helpful. Not only will we get baseline testing information for reentry on these students, but we also have the ability to have a more robust testing network, platforms that are ramped up and available to us to use for other opportunities as well.
Thanks, Dr. Harris. I'm going to unmute Lauren Walsh in just a second. Just as a reminder, if you or your outlet has already had a chance to ask a question, We're going to try and get through everyone who has a question first, and then if we have time, we'll circle back through to allow you another question. So Lauren, if you would like to ask your question.
Hey, good morning. Lauren Walsh with ABC 3340. Dr. Vickers said this platform could be used for Alabama citizens and not just college students. So which parts of the program do you expect to be expanded for public use? Would it be both the testing sites and this exposure notification app? And how soon could we see this all available to the public?
Dr. Vickers, you want to tackle that one?
Yeah, so the GuideSafe COVID screening tool is available now. There's a public version that I'll ask Sue to comment on, and the version that we have for businesses is available as they engage with us. And again, I remind people that is the baseline tool that Dr. Harris asked individuals and businesses and communities to do on a regular basis to assess their COVID status. In addition to that, Dr. Harris can tell you that when they call to ask someone about contact tracing, there is a high chance, up to 50% of the time, people don't know who they've been in contact with. This app, which will be available later this month for everybody, has the ability to do that in an automated way once you've been tested positive, to let everybody know who's been exposed. So that'll be available as well. The testing piece, as Scott mentioned, our passion and our design was not only for our students, but for our citizens of our state, as well as trying to help them, that is Alabama Department of Public Health, fight COVID by adding additional testing where there was needs. And so whether it's using the 13 sites where they are, or moving them, or redesigning them, we're planning to use that platform along with the expanded testing capacity at our Department of Pathology, which turnaround time is 24 to 48 hours at best for our citizens. And I would expect that certainly to some degree in large measure will occur toward the end of this month.
Great. Did Dr. Feldman, did you have a follow-up to that?
Sure, yes, thank you. So the public-facing version that Dr. Vickers just mentioned is helpbeatcovid19.org. HELPBEATCOVID19.org. We also have Health Check and the Event Passport that is available for businesses. And so it is for schools, businesses, and the entire community. Thank you.
Thanks, Dr. Feldman, Dr. Vickers. Dennis Pillion, if you would like to ask your question.
Yes, I guess this is for Dr. Harris primarily, but you know, with the situation right now where I think as of Friday, the average wait for people to get test results from this was something like 7 days. I'm just curious about the use of resources and you know, and kind of that angle when you know, possibly symptomatic people are having to wait such a long time to get their results back.
Sure, that's a great question. I think we've all been challenged by trying to deal with the numbers as we've seen them increase over the past few months. It has been difficult. We've had turnaround times that have, you know, sort of individually seem like kind of one-off situations. You know, this platform has a shortage of reagents, or that platform has a particular issue, and you know, all those sort of combine to add up over time. I think the thing that is appealing to us about this is that we are adding additional actual capacity. We're having additional testing capacity that wasn't there before. And it is certainly true that we're testing a number of people as well. But I think the advantage that we have by being able to use these platforms ongoing is going to more than make up for that. I think we certainly do recognize too the benefits of just population level testing in a way. Obviously, we don't want people who are symptomatic to be waiting, but at the same time, having larger numbers of sort of population level data by testing a large number of people will be very useful to us in public health as well.
May I make a comment, please? I would like to point out that very early on, when testing was hard to come by and national kits and reagents were being diverted to New York and elsewhere because of the sheer numbers. Our Department of Pathology developed their own test, which is extremely sensitive and can measure down to a few RNA molecules, but identify the virus. So they developed that test and have scaled gradually over the months to serve our patients and our population. But with this new funding, they have doubled and tripled their capacity and are running 24/7. And that's why they can have a turnaround time of 24 to 48 hours. Many of these other platforms were based on reagents and kits from outside of Alabama. And as Dr. Harris said, sometimes they were rare. They had to stop because they didn't have the appropriate materials. So that's why we have built this in for our Department of Pathology to do all these tests on all these students. But we'll continue that on our citizens across Alabama as well, especially in areas of need. And that's why we've got these 13 locations across the state to be able to meet the needs of the state.
You know, Ray, I'll remind people too that, and Mike Sag may want to comment, when we started this 6 to 8 weeks ago of planning, the turnaround times were not an issue. We were planning this to include students and our citizens of a state in this sort of serial fashion. So we are quickly making sure we can add value immediately to the community. But when this was first allocated, the turnaround times weren't the issue, and we obviously didn't have the surge we have. So we're adjusting and adapting, but the resources are used for both the citizens and the students, which was the intent all along.
Dr. Sag, would you like to add to that as well?
Sure. I think it's really important to examine the root cause of the delays, and we've danced around it, but to hone right in, most of the commercial labs where clinicians are sending their tests are dependent upon pre-made kits, and those kits are sort of one size fits all, plug it in. And as the demand nationally has picked up for those kits, that's what's in short supply, and that's what's causing the delay because the labs are having trouble accessing it. Thanks to Dr. Neto and his team, we are not dependent on those kits. We create our own reagents in essence, and as Dr. Watts said, it's a very sensitive test and it's very reproducible and quite reliable. So, and as Dr. Vickers just said, when we started this, we knew we were going to be pivoting to the state in the longer term, but we didn't see the need urgently for test capacity in the state. So what we're doing right now is we are evaluating how to pivot in the next 2 to 3 weeks, much sooner than we had originally planned, so that we can provide this service to the state, which is looking for more help in terms of capacity. And then as Dr. Harris said, we're going to be pushing this on along to support the state as we go. So we're very proud of what we've been able to accomplish, but there's an awful lot more work to do.
Thanks, Dr. Sag. Dr. Neto, did you have anything to add?
I second everything that was said, but I would also add that part of this opportunity is we're building even capacity in other universities, like University of South Alabama, which will help the surrounding community once we go beyond the student entry. We pride ourselves that we were one of the first academic centers to develop this assay, in-house laboratory developed assay, and we ramped it up to over 1,200 a day capacity clinically. And now with this, we can easily increase it 5 to 10 fold because of these additional resources and manpower that we acquired, and also spread it and share it with other universities in the state.
Savannah, one of the thought partners, although not a lot of capacity now in this process, has also been Hudson Alpha and Kailos, and we appreciate their efforts to help us in this planning as well.
Yes. Thank you, Dennis. Dallas Parker, if you would like to ask your question.
Dallas Parker with WH&T based in Huntsville. My question is, how long is the app designed to last as it stands? And what happens when we get to a point where the need for it no longer exists?
Dr. Feldman, would you like to take that one?
Yeah, sure. Thank you. So I assume that you're talking about the exposure notification app. And that is designed to last as long as it needs to last. There's no sunset time on it. It will last as long as it needs to. And when it doesn't need to last, when we don't need it any longer, that would be a good thing. And then Google and Apple will sunset it.
Dr. Carver, do you have anything to add to that as well?
Yes, this is Dr. Carver. I think the Sue captured the essence. When we do the initial release, however, we're not stopping. There are already plans for additional functionality to add and continue to strengthen it as we combat this pandemic. So all of the tools, none of them are static. They're all moving forward, and they're all being enhanced as the situation changes on the ground here in Alabama.
Kurt. John Papke, you may ask your question. You have to unmute.
There we go. Thank you, Savannah. John Papke with WVTM 13. It's a pretty simple question, actually. You mentioned testing as many as 200,000 students over the next 4 weeks, as many as 10 to 12,000 students a day. I assume this system, this testing will be required of every student that is returning to campus?
Yes.
It is, yes.
Dr. Watts, do you want to elaborate on that?
Well, yes, this will be a requirement because we have the full knowledge that having this information as our students come back to campus, coupled with our ongoing ability to test those who are symptomatic and or those who are in the Sentinel testing pool, will give us information about how the virus is behaving in our populations. And I would also say that we have a very comprehensive plan. And at the front of that is clear education about the importance of wearing a mask at all times around other people, and the physical distancing of at least 6 feet or more, and the proper hand hygiene and cleaning of all of our facilities. That's at the forefront. The one way we know we can control the spread of this virus is by having these activities. And they will be required. Masks will be required, as will physical distancing and so forth. And we have developed systems within our campuses where physically we will rearrange our classrooms. Plus, we put in technology so that anybody can access the classroom remotely. But testing and health check app, either daily or every 3 days, along with the testing, as far as Sentinel testing and follow-up, along with the exposure notification. Those are all part of our comprehensive plan.
Savannah, could I add one quick comment to that? And this is important, and it's true for all 3 of our universities, the University of Alabama, UAB, and UAH, but I believe it's also true for almost all of the universities in the state who are participating. Testing before you return is mandatory. You will not be allowed to move into on-campus residences or register for classes until you can show you have tested negative. So it's important for students to access these resources now and make arrangements to have your test because it will be required.
Savannah, can I add on to what the Chancellor just said?
Great.
In addition to testing being required for all of the universities in Alabama, use of health check is also required. And the use of the exposure notification app, while highly suggested, is not required, but health check is.
Thank you for adding that. Morgan Hightower, you may ask your question. Morgan, I think you got disappeared. Do you want to raise your hand again? I apologize. I think that was on my end. All right, you can ask your question, Morgan.
Okay, can you hear me?
Yes.
Okay, thank you. This is Morgan with Fox 6. This is really open for anyone. just considering what's happening in the state right now, are you more or less encouraged for school to restart, for college to restart? And then just considering all that you have done to ensure safety of students and faculty and staff returning to campus, how confident are you that what you have put in place is going to work?
Dr. Watts?
I guess I can jump in on
Sure,
that. Oh, go ahead.
Yeah, I'll be happy to comment.
Okay.
We have considered all aspects of returning to campus, both for our employees and our students. We have already tested this in our employees returning over the last several months. So we know that this process works if it's attended to diligently. And that's the safety measures, along with health check, along with if somebody does develop symptoms or does have a positive test, we have very rigorous medical and public health algorithms that our students and our employees would go through. And those are made available to all of the colleges and universities who have opted in on this plan, which is essentially everyone. And one of the reasons that we, as we prepared for our own students and employees at UAB and across the University of Alabama system, as we did this and we used our tremendous expertise of our faculty and leadership, we realized that others weren't going to be able to do this in the state. They didn't have a world-class medical school, public health, health professions, and the professionals we have who have helped guide us and lead us along with our leadership. So that's why we've made this available across the state. We have a high degree of confidence that we can do this successfully as long as everyone's human behavior is in the right manner, i.e. wearing a mask to protect yourself, but also to protect everyone around you. And to be serious about this, and for our students to understand that it is vital that they comply with this program, because that's the only way they're going to be able to come back to college or university and do it safely. So we have high confidence, but we have to have everyone's cooperation.
You know, I will add to that, that you heard both from Chancellor St. John and President Watts that the tolerance level for us not being able to get the behaviors and adhere are going to be very low, just because, as you highlighted, we are concerned about the numbers in our state. 6 to 8, again, 2 months ago when we started planning, we didn't see these numbers. So they worry us, there's no doubt. We also understand that we can't remove all risk. But what we do want to do is mitigate risk in a major way. So in addition to just these tools, we certainly in the UA system are encouraging every campus to have their own version of what we've designed called an incident command center. And that command center will monitor the data from the health check. It will monitor the Sentinel testing. It will monitor the people who are doing it and who's been exposed, so that our leaders will have the opportunity to intervene. It will be able to hopefully look at areas or dorms where there's increased positivity to intervene and act in a timely fashion to potentially limit the spread of the virus. And they all have recommended to have areas which we would call infirmaries, where anybody who's positive or who's been exposed will be asked to isolate or quarantine. So there's a lot of work built into this strategy to try to give us the best chance, realizing that it's not perfect and realizing that we won't get rid of all the risk.
Thanks, Dr. Vickers. Chancellor, do you have a comment you'd like to add?
Yes, that is a very interesting question. The degree of confidence. I would put it this way: you can tell from this presentation how hard these people have worked for months to provide a platform for school to be safe this fall. I believe the result of that is that we have the most comprehensive, most advanced system in the country. Now it depends on our parents, our students, our faculty, and our staff to do their part. We will be asking more of students and staff and faculty in this semester than we ever have. It will be different, hopefully will not be different for very long as we come out of this crisis. But the worst result would be that after all of this work and this system, which is so comprehensive, if students and faculty and staff don't do their part, then it will have been for nothing and we will not be successful. So we are asking and imploring for everyone's participation, everyone's support, everybody to do their part. And if that happens, it will be successful.
Thank you. Bob,
If I may follow up on the Chancellor's comment. As you mentioned, in terms of imploring students and families to participate, one thing I'd like to convey is that we've been partnering with the testing program with each of the universities to get student data, student information based on when they're coming back to campus, expected to come to campus. And we've pushed notifications via email in concert with each of the campuses, student offices and so forth. And so the first step that many of our students need to do is open their email and click through and register for testing. We have, again, 13 sites around the state that are opening up tomorrow. The goal is for convenient times and locations that folks can get to and take advantage of. But if we're not opening those emails and selecting time, we're not going to be able to deliver all the testing that we intend to and need to do. And so certainly parents, encourage your students, schools continue to encourage your students, and students take responsibility for looking in your email and getting signed up for this testing.
Let me follow up with that, Bob. This is not a walk up and show up and get your test done. These are scheduled times and locations, and you have to be actively engaged to confirm that and to show up at that time and at that place. If you show up and you're unexpected and you don't have an appointment, you'll be interfering with the process. So this is not a raise my hand, I'm coming today. This is all about opening those emails and receiving those texts and acknowledging that time and that date and showing up and getting your test done.
Yes, sir.
thank you all. We're going to go to Mark Cobb. Mark, if you would like to ask your question. Oh, apologies. I think I actually, Sydney Martin, if you want to ask your question, Mark Cobb, if you want to re-raise your hand. So Sydney Martin, you can ask your question.
Sydney Martin with Way 31. Obviously, the self-administered testing is very different than what we're currently seeing widely across the state. And these results are supposed to come back a lot faster than the current timeline for other test sites. Do you guys see this as the future of testing for the state and how we get coronavirus under control? And if Dr. Scott Harris would answer this first, and then anybody else that would like to answer.
Sure, I think this offers a lot of opportunity in how this new platform has been developed, this new way of testing has been developed. We're very anxious to see how well that goes and how well it can sort of be translated to other areas, but that absolutely is our goal. We certainly think that this offers a tremendous amount of opportunity for us to do that. You know, the current platforms that we use and the sample collection techniques that we use, like nasopharyngeal swabs, are, you know, validated for that technique with that platform and so on. So there's still got to be a lot of work done as we try to move to other ways of doing it. But I think it shows a lot of promise, and we're very excited by that.
If I may add.
Yes, Dr. Neto.
Thank you. Thank you for the question. And that was a very important issue for us as we transition to the nasal swab, which is self-administered, and for the obvious reasons, it will help us with such a large scale. Crucial for us was that we maintain the same sensitivity that we were doing with the nasopharyngeal swab. So a lot of what Dr. Harris has alluded to, we went ahead in the lab and validated that indeed we're not going to be losing sensitivity by switching to that. And there are a lot of studies already showing that it's equally sensitive. And that was the only reason we accepted to move to that. And that will bring us benefit us even to our patients down the road. We anticipate that we're switching to that platform.
Thanks, Dr. Neto. Mark Cobb, feel free to ask your question.
There, is that better? Can you hear me now?
Yes.
Excellent, thank you. Mark from the Tuscaloosa News. When we were talking about this back in June, the Stay Safe Together platform, which I think is what this is morphed from, was the money from the state part of that back then? And if not, can you tell me what the differences have been made since achieving that state funding? What adaptations to the program did you have to make or were required to make to assure the state funding?
So, yeah, the name change was not predicated on state dollars.
Okay.
We presented this concept to the state early on under an evolving name, but the principles have stayed the same. Kurt, Sue, Mohan, Mike, and Bob, and Tony and others have continually evolved and added greater sophistication along with the Bruno's team and Google to allow all of this to be to a point to be executed on. And you heard President Watts highlight the advanced components of both the app, and Sue speak about the health check COVID screen, which are really have continued to evolve to add greater value. And somebody asked how long would this last? I suspect the health check screen app will be used far after COVID to simply monitor the symptoms of kids on campus.
Thanks, Dr. Vickers.
Dr. Feldman, would you like to weigh in on that as well?
Yeah, I don't have a lot to add to what Dr. Vickers said. I think he covered it all. I would like to use this opportunity, though, to talk about the multiple features and enhancements that would not have been made possible without Dr. Thuramalai's development team and his implementation team. And also without the work of Dr. Carver's team in UABIT. I think having multiple teams, in addition to the testing teams that both Dr. Vickers and Dr. Watts has mentioned, having the IT development and implementation teams also has been absolutely essential in being able to accomplish what we've been able to accomplish. Thank you.
Then Tyler, if I could add one other component of this, is we've had a number of third-party companies that have stepped up and partnered with us. And so Motion Mob's a Birmingham-based company, Ovation, which provide the underpinnings of the testing software, Verily, a Google-owned company, which is the client-facing component, PWN, which is the back office component, and then Everlywell, which is a mail-in component. We had to integrate all of those systems together, but those third-party companies have made invaluable contributions, as well as Apple and Google, in moving these platforms forward.
Thanks, Dr. Carver. We'll start back up at the top. We've got a few questions from folks who have asked before. Michael Casagrande, you can ask your question.
Yes, just for the medical professionals, just on August 3rd. Just wondering what the medical thoughts were about resuming collegiate athletics, what needs to happen for them to stay safe, and the confidence level. I guess what's the confidence level in their ability to perform?
So I think that there are two components of that. One is the environment of the athlete, which I think the Power 5 conferences have a very comprehensive strategy, some testing up to 3 times a week. Our college athletics in the system are going to use the COVID screening tool daily for their athletes to make sure they monitor their symptoms, and they'll use the event passport to know whether they can go to practice. They'll tentatively test both on the beginning of the week and the Friday before a game. And some maybe midweek based on if there are any symptoms that are evolving. So I think that environment is somewhat controllable and one that they can actually create a semi-bubble. The second piece is the fans. And I think you're hearing about really decreased density, but we've spoken about with our athletic departments in the system about using even the COVID screen tool for the fans who are coming to the game to be aware of their own symptoms and determine who should come in and come out based on that. But I think masking and density are going to be crucial for whatever fan density number they choose. We certainly would love to have people use the COVID screening tool as a part of knowing if you're going to show up that you don't have symptoms, and see if it's possible. So I think there is a legitimate possibility. There is certainly the possibility like that's occurred in the NBA and MLB and racing, where there are just no fans. Everybody is on viewership through TV, which is obviously another option that could occur. But I think most are planning on some low density fan participation.
Savannah, can I add one thing onto that? I think the other thing that it's important to remember when we think about athletics and other large events like that is that there's really no one magic bullet that's going to get us back to pre-COVID times. It's all a balance. And as we try and balance being able to get back to whatever we want to define as normal operations, it is likely a combination of things. So it's not just masking, but it's masking and social distancing. It's not just masking and not just social distancing, but it's masking, social distancing, and being able to take advantage of the electronic tools that can work either in the background or with the user being able to use them, such as Health Check or the exposure notification app. Using all of those things together, everything that the GuideSafe platform offers, plus masking and social distancing, creates a really comprehensive toolkit that hopefully will enable us to be able to balance back to normal operation.
Thanks. We're going to go to Lauren Walsh with ABC 3340. If you want to unmute yourself.
Thank you. So you said that the testing component of this is mandatory for students before returning. I just wanted to be clear, is the exposure notification app, is the participation in that also mandatory? And then whether we're talking about a college campus or the state of Alabama, what percentage of a population needs to participate in an app like that with the exposure notification for it to be successful?
Dr. Feldman, do you want to take on that one?
Sure. So the exposure notification app is not mandatory. It is highly suggested, strongly suggested, but it is not mandatory. There's several things that preclude it from being mandatory. One being that you have to have a certain operating system on your phone. Second, that Google and Apple say that states cannot make it mandatory. And that's part of why we chose the Google Apple app, was for their respect for citizens. Now, in terms of your other question, this is a really good question that we've thought about. And you know, what is the tipping point? Like, at what point do you get enough people involved to be able to say, we're going to make a difference? And I have heard various numbers thrown around. I've heard 20%, I've heard 30%. I would offer it up to my other colleagues on the phone, and maybe they have some more definitive guidance on what is that tipping point of adoption.
You know, the only comment I'll make and then Kurt is that if we could require it, we would. It's an important tool. There are basic parameters that keep it from being required. So don't take the idea that it's suggested or highly recommended as a de-emphasis on our belief of its role and priority at being safe. Kurt.
And this is Kurt. I think the best way to view this is the more people that use it, we will lower the R naught value of the state. We will lower the spread of this virus. So the more people that use it, the better, but it is not mandatory. It is just highly encouraged. And the focus should not be on what level of participation. The focus should be on the more people that use this, the more heroes we will have fighting this virus, because everybody's participating to stop its spread.
Mohan, would you like to make a comment?
Sure.
So the effectiveness of the app.
Excuse me, could I, yeah.
Sorry. Go ahead, Chancellor.
I was just going to add, I know that some of this may be confusing. Testing is required. The symptom tracking device application is required. The contact tracing app is highly recommended, but you will have to be enrolled on the symptom tracking app to re-enter school. So it's really three different things. I mean, excuse my interruption.
Sorry. Oh, no problem. The effectiveness of the exposure notification app at a population level and individual level is different. This app, you don't need thousands of people to participate in it for it to be effective. If you are moving in a group of 30 people, and if the 30 people are using, the app is equally effective as if even 100,000 people were using. So this is not like a social networking platform wherein you need a critical mass for it to work. So just, while we are testing in our house, 3 people have it. Already it's going to tell me, as we are testing, I say I am positive, my wife gets it. And so that's the whole main point behind this app. So you need not wait for entire Alabama to be using it. Every individual starting to use it is most important.
Yeah, and I think one other point, this is Kurt again, that we didn't mention and I should have mentioned is that Dr. Harris has exceptional contact tracing. And it's a very good process for doing an interview and tracking everyone that you can remember that you came into contact with. One of the challenges with that system is it does not do a good job of identifying strangers and people that you can't remember or people that you don't know the name of. And the exposure notification app is exceptional at remembering strangers and remembering people that you forgot about. And so it's the combination of both approaches that indicate us moving forward as the state of Alabama and having a robust system for tracking the spread of this particular virus. You need both of them. And then when you couple that with the entire platform, you have this really robust overarching strategy of defeating COVID-19.
If I could just add to what Dr. Carver said, that he makes a great point there, and particularly as we're dealing with the issue of turnaround times that have increased a bit, the app is so much more helpful. If you get tested today and find out tomorrow, you might remember who you've been around the last few days. But if you get tested today and you found out a week from now, it's going to be really difficult to remember all those contacts you might have had.
All right, we're going to go to WTVY. You may ask your question. WTVY News, if you've got a question. Okay, we're going to move on. Caroline Beck, if you'd like to ask your question.
Yes, thank you. This is Caroline Beck from Alabama Daily News. I was just curious if you guys could comment. I know when we talked back in June or when we first were discussing this platform that there was comments made that testing would be happening throughout the school year for students. I was just wondering if you could say if that was still the plan and also say like what the capacity would look like for that testing and if it would just be determinate if a student was exhibiting symptoms or kind of how that testing would go. And also in connection to that, I know it was commented that this platform is kind of made possible because of the CARES Act funding and the $30 million. So is future testing capacity for college students going to be dependent on funding like that? And is, necessary funding in that scale going to be necessary to see this kind of continued testing effort in the future?
Dr. Vickers?
Yes, so and then I'll have Dr. Sag and Neto if there are comments. So we realized there were two components that we're adding, and it's belts and suspenders, is that we wanted to provide a reentry test that documented the student status. The second piece is that we realized that they're living in a high density environment, often different than our community, that we needed some method for all of the constituents on the campus to be tested. What we believe, with the help of our public health leaders, and you heard Dr. Watts mention Dr. Paul Irwin and Dr. Suzanne Judd and Dr. Pam Benoit, one of our provosts, what we believe is crucial is to have a ongoing set of tests that takes a sample of citizens throughout the campuses. And it's been done by many, and it's being done by many campuses in order to get a sense of the level of the virus prevalence in our communities. I mentioned this incident command center to look at that data along with the health check data, which gives you exposure and symptoms and compliance. And so that will be available throughout the year. And it will be probably on the order of 15 to 20,000 tests a week if we include all of the campuses across the state that would participate in that. Yes, it will require more funding to get that done. And we believe it's a valuable piece, but the funding will not just be for campus kids. The funding will be for the state citizens as well, for us to gear up to support Dr. Harris's efforts across the communities where there's increased prevalence of the virus. Now, mind you, I don't know that we will be doing pooling testing for those symptomatic patients, because there's a much higher risk that those will be positive.
Thanks, Dr. Vickers. All right, we're going to wrap with one final question from Mary Scott with WBHM, if you'd like to ask your question.
Hey, this is Mary Scott with WBHM. I am curious to know what the process is for testing students who are coming from out of state.
Dr. Sag?
He had to hop off. Is there someone else who'd like to answer?
Yeah, so I was giving him the opportunity. So we had to do a lot of adjustments because the Bruno's team and Verily, which is the Alphabet or Google company, are leading this testing effort now. So Verily Well is a partner of ours that has self-administered test kits that they mail all over the country, and they allow to be overnighted back to a testing lab. And so that's been the component of testing outside of the state. Is Bob Phillips on? Is Bob still on?
Yes, sir, I am.
Bob, do you want to add anything to that?
Certainly. Yes, it's Everly Well is our partner for the mail home kit. We have a lot of partners with V's in the name. So Everly Well is the mail home kit. And again, as we've been in contact with all the universities about their out-of-state students and when those students need to arrive, we've tried our best to push out those mail home kits with enough lead time so that they can be received, administered, and sent back to a network of labs across the country. And so we're continuing to monitor all those out-of-state students and provide an option for them. Certainly, if students are coming back early or moving into an apartment or so forth, they all also have the opportunity to register for one of our in-state collection options, and that may be a good solution for them as well.
Thank you.
All right. Yeah, thank you, Bob, and thank you, everybody, for joining us today. We do want to thank you for staying on to listen to these important GuideSafe initiatives. A news release with additional details has been distributed to each of you. If you did not receive it, please feel free to reach out to me, to Savannah, or to Ashley Fulmer at Big Communications, and we will get that to you quickly. Also, please visit www.guidesafe.org for additional information on the platform, and please do share it with your audiences. And for media purposes, we have added a digital media room that has been established at www.guidesafe.org/media. That features graphics, photos, and B-roll video and interviews that you can use with your stories. We plan to hold an additional news briefing later this week to highlight the testing capabilities of GuideSafe. And once we have that day and time finalized, we will get that communication to you. So thank you again to our panelists, and for the media, thank you for joining and doing all that you're doing to keep the public informed during this pandemic. We do greatly appreciate each of you and your work. Have a great rest of the day.